So sideline, I think the, on which client would you use sideline technique?
Pregnancy.
Pregnancy?
Cold.
Sorry?
Cold.
If they have cold, right? Because facing down, very uncomfortable for them. Obese, hard for them to lie. People
Women who are very big. Yeah.
breast. Who else?
Like lower back pain.
Back pain. Absolutely. If somebody's having a more than just an ache, try to put them sideline, because facing down, especially if they're saying, actually, how do you know who not to put facing down, facing up? From the consultation.
How they sleep?
Exactly, how do they sleep? How do you sleep now? Oh, I can't sleep facing down because I'm locked. You know, I'm always on the side. All right, you know, I can't put them facing down. How about people with problem more in one side, right shoulder pain, more the right side of the spine pain? Yeah. Okay. So we did one demonstration on the spine. I will do now more on the shoulder. Okay. So basically, it's pretty much the same as we did before. Three positions. So we're having now 1, 2, 3, 4 position, and then you're moving the shoulder. Yeah, you have a nice position here for the thumb. Yeah, to work on the upper trapezius. Very slow. You have a position here to work with your knuckles here. Which muscle do I work now on? Scalenes. Good. So, look, there is a difference between that, I move more myself, or that. This is more shoulder movement. Be generous with. Okay. If you find that this is hard, then do something like maybe that. But try to have as much as possible connection to their body with your body, and you leading them. Okay, good. Now, few add-on to that. First of all, as most of our clients coming with shoulder forward, once you do that, you can assist them into taking the shoulder backward and stretch. Which muscle here in the front will be tight? This position. Which can you palpate? Can you palpate on yourself? Which muscle will be tight in here? Pectoralis major. So you can come from here and really nicely work. Now, how many massage therapists do that? Very little, really. They all work on the back, but the shoulder here is tight. So you need to really do that movement, that stretch backward to allow the shoulder to go back to its normal place. Even put their shoulder this way, support it from the back, and then move it nice backward. Yeah, maybe this camera could come somewhere else. So again, from here, you're putting the hands here. Do you see the shoulder blade? And then you're pushing the shoulder blade back into place. Or you can come from the front and do pretty much the same thing. This hand stop, this hand move. Well, really nice stretch. Or the opposite. Yeah, that seems to be more comfortable. So you see that scapula here? I'm avoiding it, touching it, because the scapula needs to go backward. So I'm actually supporting the spine, push the shoulder so it goes back to its original place. You can do that with a little bit of rotation of your body. Yeah? So hold that in here, back, and then I don't push that shoulder that way, but basically I rotate my body. Too much?
No. Sorry.
Okay. Then, another problem we have is that not only the shoulder is forward and down or up, but also we never have this time to really stretch ourselves. So imagine that the monkeys that we all been before, how nicely they kind of stretch up the rib cage. So if we don't have that, we can give it a bit of in the treatment. So you can do stretch upward and then nicely mobilize the ribs here. Again, teres minor and teres major muscles in here. You can work on the scapula and moving it, but really just separating the hip and the rib cage. Yeah? Ribs movement. So again, you can come from here, hold it, and then assist this movement by stretching. So what you're trying to achieve really is a nice, just side stretch to all of that. All of these little ribs here and there, and even quadratus lumbarum you can. This accordion movement of the ribs, you know, it goes like an accordion, open and close. So open and the space close between. Open, that's what you're actually trying to do. You assist in the natural movement that the body forgot. Shall we go a little bit to the neck? Yeah? In the neck, I really like doing coming to the erector spinae from the back, one hand on the head, and this is a really nice, very quiet position to work on the erector spinae. It's very easy. Suboccipital area. Once you're there, temporalis muscle, or remember how this muscle called? Occipito, frontalis, from the occiput to the front. This is a major muscle that spread headache, tension headache. Even take the neck on the back, so my finger on the opposite erector spinae, and the wrist, the base of the wrist is on that side. And basically, I'm just kind of shearing it a little bit up and down. It's like side bending to the neck. And then going a little bit onto the upper back. So if this is the spine, I go underneath and tug the spine like that. So if this is the spine, I go underneath and move it a little bit. Small movement. There's small movement between two vertebrae. Yeah? Don't want to overload you. It's nice to do small positions. So start really with a shoulder mobilization. 1, 2, 3, 4. Move it, and then massage with, and then you can take it back, do the nice stretch to the back, work on the pectoralis muscles, and then I'll call it aloud from there. Any questions or